In this video, we'll be discussing about diuretics. Now, diuresis is the increase or excessive production of urine. Now, let us look into the normal physiology of urine formation to better understand the mechanism of action of these diuretics. So here we have a simplified picture of the nephron showing the Bowman's capsule, the proximal convoluted tubule, the descending and ascending loop of Henle, the distal convoluted tubule, and the collecting duct. Now the reabsorption of water and solutes takes place across the entire nephron, but there are two most important sites where the reabsorption of sodium takes place. Is one in the thick part of the ascending loop of Henle, and the important channel through which the reabsorption of sodium takes place is the sodium potassium 2 chloride symport system, which is present, remember, in the thick part of the ascending loop of Henle. Now another site is the early distal convoluted tubule, where the reabsorption of sodium takes place via the sodium chloride channels. So this is the reabsorption of sodium in the nephron. Now another important site is the collecting duct, where the reabsorption of sodium and water is influenced by a hormone called aldosterone. Now aldosterone binds to these receptors and it increases the reabsorption of sodium and water. Now diuresis can be induced by increasing the concentration of solutes within the tubules. This osmotically attracts water into these tubules and hence causes diuresis. The two main mechanisms by which this is achieved is by number one, by blocking the sodium potassium 2 chloride channels in the thick part of the ascending loop of Henle, and two, by blocking the sodium chloride channels in the early part of distal convoluted tubule. Now the drugs that inhibit the sodium potassium 2 chloride channels are known as loop diuretics, and those that inhibit the sodium chloride transport system are known as thiazides. Now the action of loop diuretics, as we've mentioned, they block the sodium potassium 2 chloride co-transporter systems. Therefore, there is an increased concentration of sodium, potassium and chloride which moves to the DCT, and these solutes, they attract water in the distal part, causing diuresis. Now an important point to note is that these drugs also decrease the reabsorption of calcium and magnesium in the thick loop of Henle, and hence these drugs are also called calciuric drugs. That is, they increase the urinary excretion of calcium and magnesium. In contrast to this, thiazides decrease the urinary concentration of calcium. Now if you look into the cells of the early DCT, we have on the luminal side the sodium chloride co-transporters, and on the other side we have the sodium calcium exchanges. Now suppose the thiazides act and these channels are blocked. As a result, the amount of sodium within the cells decrease. Now this is compensated by an increase in the action of these sodium calcium exchanges, which for every calcium reabsorbed secretes sodium into this cell. So remember, if these channels are blocked by thiazides, then there is an increase in the absorption of calcium. Okay, calcium from the lumen goes into the cell and is reabsorbed. So this is the mechanism of how thiazides increase the reabsorption of calcium and magnesium, or in other words, decreases the urinary excretion of calcium. Okay, so this is the basic difference between loop diuretics and thiazides. Now loop diuretics can also block higher concentration of sodium than thiazides, and hence they produce more natriuresis and diuresis compared to thiazides, and hence loop diuretics are also known as high efficacy diuretics and thiazides are known as medium efficacy diuretics. Now coming to the classification of diuretics. Now diuretics can be classified into high ceiling diuretics, medium efficacy diuretics and weak or adjunctive diuretics. Now we've discussed the high ceiling diuretics, which are basically the inhibitors of the sodium potassium 2 chloride co-transporters. The examples of these are furosemide and bumetanide and torsemide. Now medium efficacy diuretics, we've discussed that these are the inhibitors of the sodium chloride symport system, the examples of which are benzothiazines and thiazide-like drugs. Now benzothiazines include hydrochlorothiazide and hydroflumethiazide and benzthiazide. Thiazide-like drugs include chlorthalidone and clopamide. Now we have certain weak or adjunctive diuretics. Now these include the carbonic anhydrase inhibitor acetazolamide. Now how this works is basically within the proximal convoluted tubule, a part of the sodium is reabsorbed via the sodium proton antiport system. Now we have H2CO3, which is acted upon by carbonic anhydrase enzyme and converts it into H plus and bicarbonate. Now the proton is secreted into the tubular fluid, whilst for every proton that is secreted into the tubular fluid, one sodium is reabsorbed. So hence by blocking this, we can decrease the amount of sodium reabsorbed and hence cause natriuresis and diuresis. So this is how carbonic anhydrase inhibitors work as a diuretic. And remember, the example of this is acetazolamide. The next weak or adjunctive diuretics is osmotic diuretics. Now the examples are mannitol and glycerol. Now now mannitol and glycerol increase the osmolarity of the tubular fluid, which attracts water and causes diuresis. Now the final class of weak or adjunctive diuretics include the potassium sparing diuretics. Now within these we have the aldosterone antagonists and the renal epithelial sodium channel inhibitors. Now to better understand how these drugs act, let us look into the normal physiology. Now this represents the cells of the late DCT and the convoluted tubule. Now most of the sodium has already been reabsorbed. Now whatever sodium has come to the collecting duct, it enters the cells of this part of the nephron via the renal epithelial sodium channels, and this is pumped out with the help of the sodium potassium ATPase. Now the potassium within the cells, these are secreted back into the tubule via the potassium leaky channels. Okay, so remember, for every sodium that is taken up by the cell, potassium is secreted. Now when aldosterone binds to the aldosterone receptors, this entire process is enhanced. So what happens when aldosterone binds? We have increased sodium reabsorption and increased potassium secretion. Now if the aldosterone receptors are blocked, what do we have? Decreased sodium reabsorption and decreased potassium secretion. Hence in this way we have the potassium sparing effect by the aldosterone antagonists. Another mechanism by we can induce the same effect is by blocking the renal epithelial sodium channels. So this constitutes the next class of drugs known as the renal epithelial sodium channel inhibitors. Now let us look at the examples. Now the aldosterone antagonists include spironolactone and eplerenone, and that of the renal epithelial sodium channel inhibitors include amiloride and triamterene. Now a simple mnemonic to remember these diuretics is Facebook and Bluetooth cops. So remember, Facebook and Bluetooth cops. Now F and B for furosemide and bumetanide, which are the high ceiling diuretics. B and T for the benzothiazines and thiazide-like drugs. The examples of benzothiazines include the hydrochlorothiazide and hydroflumethiazide and benzthiazide. Now the thiazide-like drugs include chlorthalidone and clopamide. So these are the medium ceiling diuretics. Now COPS for carbonic anhydrase inhibitors, O for osmotic diuretics, PS for potassium sparing diuretics. Now remember, carbonic anhydrase inhibitors are acetazolamide. The osmotics include mannitol and glycerol, and potassium sparing diuretics, as we've mentioned, can be done by two mechanisms: the aldosterone antagonists and the renal epithelial sodium channel inhibitors. The examples of the aldosterone antagonists are spironolactone and eplerenone, and that of the renal epithelial sodium channel inhibitors are triamterene and amiloride. So remember the simple mnemonic: Facebook and Bluetooth cops. FB the high ceiling diuretics, BT the medium efficacy diuretics, and COPS for the weak or adjunctive diuretics.